Hello, and welcome to EMS Focus webinar series hosted by the National Highway Traffic Safety Administration's Office of EMS. My name is Clary, and I'll be your moderator for today's session. Today's webinar, Working Together for Safer Responses, Collaboration Strategies for EMS and Highway Safety Partners, will examine how strengthened relationships between EMS and highway safety can help advance a safe system approach, improve post-crash care for patients, and enhance responder safety. Today, you'll hear from Maine Bureau of Highway Safety and the Maine Office of EMS. They will discuss their statewide collaboration model, how it brings EMS together to support safer, more efficient roadway responses. The EMS Focus webinar brings federal, state, and local leaders directly to you, which provides members of the EMS community with a unique opportunity to learn more about federal EMS efforts and programs. Before we begin, let me cover a few quick housekeeping items. Please use the Q&A button on your Zoom control panel to submit questions throughout the session. We'll address them during the last 15 minutes of the webinar. Feel free to submit the questions as they come to mind. Our facilitator will organize them for our Q&A portion. Closed captioning is available by simply clicking the Show Captions button at any time to enable this feature. Let's start by focusing on the mission of NHTSA's Office of EMS. Our office supports the improvement of patient care in the out-of-hospital setting nationwide by bringing together data and experts to identify critical issues in the EMS field, collaborating with partners, including federal agencies and national organizations to address those issues and to promote awareness and education about best practices and evidence-based guidelines. The one way we achieve our mission is to provide resources. The Resource Hub on EMS.gov makes it easy to browse, search, download documents, and reports and guidelines. These resources are created by NHTSA's Office of EMS, members of the Federal Interagency Committee on EMS, or FICOMS, and others to advance EMS practices. To access these materials, scan the QR code on your screen or visit www.ems.gov. NHTSA is a public health entity that focuses on the issues of death and serious injury on our nation's highways. Each year, tens of thousands of people die in motor vehicle crashes. But what's significant is that 43% of those victims were still alive when EMS arrived. That tells you there's a critical window where intervention can change outcomes. This opportunity and responsibility depends on effective and collaborative post-crash care. A successful crash response doesn't start with EMS arrival, it starts with detection and dispatch. 911 telecommunicators, EMS clinicians, and highway safety partners each play a role in shaping what happens next. From 911 to activation to the care delivered on scene, every action influences survivability. When care is delivered quickly and appropriately, injuries are less likely to become fatal. Survival depends on how patient care moves across the response system. From 911 to EMS to trauma centers, each link in the chain plays a role. Highway safety partners help enable seamless responses through traffic management, scene safety, and coordinated planning. Strong collaborations across this continuum, especially with EMS and highway safety, lead to a faster care and better outcomes. That brings us to today's focus. Maine demonstrates how cross-agency data sharing supports smarter planning, how integrated EMS and highway safety leadership strengthens responses, and how coordinated practices create a scalable model that other states can adapt. It is now my pleasure to introduce our first speaker. Lauren V. Stewart is the Bureau of Highway Safety Director within Maine's Department of Public Safety. Director Stewart will share how Maine's cross-agency data sharing and collaborative planning have advanced roadway safety and how they have leveraged available funding opportunities. Director Stewart, the floor is yours. You're not audible yet, Director Stewart.
Good afternoon. Thank you, Clary. Good morning, good afternoon to everybody, the participants, depending on where you are. I'm really excited to talk with you all today. And usually I like to start out by sharing a little bit about Maine. For those of you who may not be familiar, Maine is widely considered the most rural state in the US based on the percentage of its population living in rural areas. Estimates place over 60% of our population in a rural location. 50%, approximately 50% of our land area is nearly uninhabitable, and it consistently ranks at the top for rural population density. We're more rural than urban. In fact, there are only 3 urban clusters: Portland, which is our largest city in Cumberland County, Lewiston, Auburn in Androscoggin County, and Bangor in Penobscot County. And if you can see the map on the screen, I've listed the 16 counties and where they're located around the state. Our largest county, Aroostook, at the very top of the state, only has a population of a little over 67,000. Yet this county is larger than both Connecticut and Rhode Island combined. Maine itself has a population of just over 1.3 million. We have 3,500 miles of coastline and 17 million acres of forest land, which is home to 6,000 lakes and ponds. So reliable technology, including internet, is difficult at best in many places in Maine. And as you can imagine, sometimes it takes EMS considerable time to get to the scene of a crash and considerable time to transport to the nearest hospital. We only have one level 1 trauma center, and that is in Portland in Cumberland County. These are just a few reasons why post-crash care advances are so important to Maine. State highway safety offices and EMS are increasingly collaborating on post-crash care by including EMS into safety plans, focusing on responder safety both inside and outside the emergency vehicles, and utilizing data for quality improvement. For us here in Maine, collaboration initially began in the early 2000s through our Traffic Records Coordinating Committee. Maine EMS and the Bureau of Highway Safety saw an opportunity to collect run reporting data electronically, and we built a system to allow pre-hospital providers such as EMTs and paramedics to use laptops to immediately enter run information directly after the run. The Highway Safety Office could then use real-time EMS data, including response times and patient outcomes, to improve and inform state safety plans and to increase our timely data entry into the National Fatality Analysis Reporting System. Further collaboration with our EMS resulted in increasing NEMSIS compliance through collection of these standardized data elements. Through the safe system approach, we're hearing more about how highway safety and EMS and 911 can work together. If zero is our goal, it's imperative that we share information and resources to make our safety plans stronger and more inclusive. So what can EMS offer to the state highway safety offices? Easy answer: data. Asking your highway safety office about the data you have and what they might need is a great place to start. What are some of the EMS data that could be helpful to a highway safety office? Well, first, number of crashes that EMS respond to in any given year, number of seriously injured crash patients that EMS treat in a year, number of crash patients that were unrestrained or ejected from a vehicle, roadway locations that frequently result in serious injury crashes, run times, including rural locations and patient outcomes, and numbers of crashes involving first responders, both inside and outside the vehicle. Data such as this can help highway safety offices and professionals understand the scope of post-crash care and lead to possible countermeasures that increase post-crash care outcomes and help to ensure first responder safety. Now we'll ask the question, what can state highway safety offices offer to EMS? State highway safety offices are usually heavily involved in their state's traffic records coordinating committee and can offer information regarding data integration and planning. They can offer funding for projects directed at first responder safety, including alerting technology designed to prevent roadside deaths. They can offer funding and resources, such as NHTSA EMS assessments, to identify gaps in best practices in legislation. They can fund research projects. In Maine, we funded a run report data analysis and a lights and sirens research project for our EMS office. You can fund education specific to EMS, such as the importance of seatbelts and the dangers of fatigued and drowsy driving. And we can always fund public education, such as helping the public understand their role in emergency, and of course, for the slow down, move over law. All right, if you're wondering where to start to establish, maintain, or strengthen the connection between EMS and the State Highway Safety Office, one good place to start is by finding out where your state EMS office resides and who your state EMS director is. Each state may be set up a little bit differently. In Maine, Director O'Neal and I are very fortunate that we both reside in the Department of Public Safety and we both report to the same commissioner. We meet at least weekly through our Bureau Directors meetings and any other time because Director O'Neal is engaged in our Traffic Records Coordinating Committee and the other committees that we have. But no matter where your office resides, you can make connections by ensuring, oops, I think I went one too far there. Sorry, by ensuring that EMS is a key stakeholder and participant in the development of your strategic highway safety plans and your triennial highway safety plans, inviting your EMS folks to participate in your state coalitions or committees. For Maine, that's our Maine Transportation Safety Coalition. I've mentioned it before, but make sure your EMS is an active member of your Traffic Records Coordinating Committee. Discuss and explore opportunities for collaboration, including data and funding for training, public outreach, and equipment. Working together towards zero by involving your EMS folks in your highway safety efforts, states can leverage expertise and data to strengthen post-crash care outcomes, enhance responder safety, utilize effective countermeasures to save lives, and be fully integrated into the safe system approach. Thank you again for the opportunity to share Maine's successful relationship between our State Highway Safety Office and our EMS. My contact information is here on this slide. And please feel free to reach out at any time.
Thank you, Director Stewart. Next, we'll hear from Wil O'Neal, State EMS Office Director for Maine, and he's also the staff representative to state to Maine EMS Board. Director O'Neal will discuss how alignment between highway safety and EMS systems improves safety in Maine, particularly given the state's rural geography. He'll also highlight opportunities for practical collaboration and how coordinated operational practices strengthen EMS response. Director O'Neal, the floor is yours.
Thank you so much, Clary. And thank you to Director Stewart. I would just share, I think Director Stewart is well known on the national stage and to her transportation safety peers. I'm hopefully not as well known, but I did want to introduce myself briefly. I've been in EMS since I became an EMT in 1997 in Albuquerque, New Mexico. I've worked as a paramedic in the 2000s, an EMD quality assurance professional, a CEO, regional CEO, and I've worked across the Southwest, the Northwest, and now in the Northeast with 28 years total in EMS, and the last two here as my humble honor to be the director of Maine EMS. The reason I share that is because in that entire 28-year career, I have longed for an engaged partner who cares as much about safety and looks at the state as a system in the way that Director Stewart does. She's talked quite a bit about some of the advantages that we have, and I'm going to beleaguer some of those points because they're just so worth talking about. But one of the first things that I wanted to highlight is that some of what I'm going to talk about from the EMS perspective are things we've accomplished. Some of it's our inspiration, designed to give you inspiration, and some of it's ambition, things we have here in Maine that we're going to be looking to work together on. And that in Maine, we do have some unique advantages that I think it's very important to be transparent about. So when we say two agencies, one system, and a shared responsibility for safety, like Lauren said, we report to the Commissioner of Public Safety, who was just down the hall from my office and right down the hall from her office. The number of doors, that proximity we've talked about, that absolutely matters. And I think here in Maine, that does give us a bit of a unique advantage. I will address that more here in a second. Additionally, here in Maine, through rule and cost, we have a unified EMS data set. So 100% of the EMS agencies in Maine under our rules operate under the same ePCR that then has a hospital hub download for outcomes. So we're able to leverage all the EMS data in our state. And I know that's a unique advantage that many states do not share. We also have a data team independently inside our office of EMS. Please don't tell people because they might take it. But having a team that can really finesse and look at our data in real time and report it out, export it to different places is tremendously valuable in our efforts through the TRCC and to continue to look at post-crash safety, and more importantly, to build our future of mutual safety programs for the two of us working together. So I want to just get those things out of the way. Our teams aren't big enough because we work at the state level. And I think there's very few folks I've run into that are my peers that say, oh, we've got plenty of resources. Rumor had heard it from Hawaii, but that's all I'm going to say about that. Other than that, our teams aren't big enough. And here in Maine, we have another unique challenge that I'm going to address head on, which is we're a no mandate state. So even if Director Stewart and I, as the EMS director, say, hey, we have this great idea, we'd like X rule to say that at least folks have to have an ambulance coverage plan in their county, region, area, right? We cannot, from a legislative perspective, force that through. It goes through a very cumbersome secondary process. And I would say unpopular is not even the word I would use to describe that in terms of the cultural climate. So those challenges are real for us. Lastly, I would say, despite the tremendous ability we have to pull crash data around pedestrian and other types of injury and crashes, we're still very challenged around ambulance crashes, and even more so around secondary events or kind of that fourth wave events, right? The third and fourth vehicle that have an accident after we've cleared an intersection. So those are some things I wanted to talk about before I move to the next slide. And then lastly, Maine is really unique in another way in that as you look at the ambulance desert study, which was done by one of our key physicians here, Maine has almost more ambulance stations per capita than almost any other place. So we've got plenty of ambulance folks, right? The problem is we're also so rural that we're way down towards the middle, towards the bottom in terms of our ability to get where people are. And a lot of that has to do with access and infrastructure. There's a whole section of our states that, as Lauren articulated, does not even really have a road through it. A big section of the state, remarkably large when you see it in person, I would say. So I just wanted to highlight that before I move through. That rural geography certainly amplifies roadway and response risk both, and that's why our post-crash safety risk project was so important. So as we look to align safety here in Maine, one of the things that Lauren talked about is, you need to know where your person is. For EMS, we're actually really hard to find, even for me. My national peers, some are in Department of Health, some are in Transportation, some are in the Department of Regulation, some are in licensing, some have their own office. Here, we're in public safety. The nice thing is that variability is not actually the same for highway safety. As I've learned from Director Stewart, your highway safety office exists pretty much in the same place across the board in your government. And so it's fairly easy for you as an EMS agency, state official to reach out and find those folks, as the opposite may not be as true. That said, the tremendous ability of our department to work with a department like Lauren's to wade into a large project like post-crash safety and look at the way we could leverage those relationships to pull funding in to provide training and information, to connect vehicles to modems that then could talk to road signs and applications, to give pedestrians a way to pre-alert for post-crash, right, and help keep our providers safe. And then from there to look at how can we build that out to continue to increase public awareness and continue to leverage the next layer of, fancy signs and technology as it becomes available. The other piece of that I want to make sure and highlight is there's a lot of tertiary and secondary benefits to our relationship in not just a project like post-crash safety with Director Stewart, but just in the relationship in general, right? Because as we started carving things out and we said, okay, now we have connected vehicles that can talk to road signs and do these things, we realized that also those vehicles have AVL that talk to the closest dispatch center, right? And so in a rural state like Maine that maybe didn't have that before, now I'm enabling closest EMS unit response, which has the potential to reduce the number of miles on the road that my EMS vehicles are traveling code 3, by default, reducing their risk of injury or death, right? So all these things, as you start to kind of pull the threads on them, I think they're very important. And each one of them, you can kind of articulate the clear value of. Another component of that is as dispatch is able to look at units in real time and have a better idea where they are, that gives our whole system the potential to improve. It brings in QA data, it brings in timestamps, it allows us to look at time-sensitive illness, things that we really care about. And now, as we're starting to see the crossover in trauma data and talking about survivability post-crash, time-sensitive illness is really going to become a portion of that. So I think those things in particular are really important. I wanted to make sure and highlight is, in the benefit of working with Director Stewart's team, we found secondary and then occasionally tertiary benefit as projects have unfolded, and I think that's important to know. A little bit busy on this slide, but I think it's just important to talk about, depending on where you are, you may not be in a state agency director seat where you can walk across to the other director and say, let's do $1 million project to connect 200 ambulances, right? So start small. Like, where is your shared area? Where is your shared working group? If you're just one agency and you have access to just your data, connect with your highway safety office and talk about what would be a cross-agency work group, who is already doing a TRCC or has a like work group, a TAC that you can participate in so that you can start asking questions about your data and their data. Because, the reality is, even as we start small, the crossover is obvious, right? If I'm a small agency, let's say I have an ambulance that goes out 50 miles a day. If it does that 7 days a week, right, and does it several weeks out of that year because we keep them busy, now just that one vehicle is on the road 18 to 20,000 miles a year, right? And we're talking potentially more than that as your fleet of vehicle grows, et cetera. And so the connection of one point of safety, and some of those that I'm going to talk about a little more tangibly in a second, it's an exponent how it grows out from your initial effort. And I want to make sure and stress that. Additionally, as we look at shared crash response and outcome data, joint roadway and scene safety education, we can ask questions about what's going on. What's going on with our ambulances? Is speed an issue with our ambulances? Do we have safety equipment or cameras on our ambulances? Or policies that support EMS safety in place across your jurisdiction or even just at your agency? A question that I like to ask a lot now that I'm at the state level, and I've seen it at the local level and it's at the federal level. I worked at an international company as well. How often do we train emergency vehicle operators on safe driving? It's not a national policy that I've seen. It's not a state policy in most places. We leave that a lot of times up to the local jurisdiction. But what I've seen, and this is just my anecdotal experience, is most folks do it pre-hire and it's not done again, or it's on some sort of maybe every 5-year requirement. Even FedEx and law enforcement partners train much more regularly for things that we're doing every day. And I think it just makes sense to look at that as, is that a safety initiative that we could talk to our highway safety partners about? Driver training around safe EMS operations? I feel like that's the kind of thing that would get Director Stewart's ear almost immediately, right? And the kind of thing that opens up other conversations about whole processes happening and are they efficient? That said, we're wading into a new program. And when I talked about starting small, I had the potential with Director Stewart to work on a very large scale project. And I feel like one guy's perspective that we were very, very successful. But where we really see success, I think sometimes is on those small things. So we're starting a new project that we're going to roll out as a micro learning called the 5 points. And this is around gurney strap safety and specifically the use of shoulder straps, right? Got data that reflects this. This is a highway safety problem. It's an EMS problem. It's a policy problem for agencies, and the state could consider looking at, should it be regulated? In Maine, it absolutely is. But we still see difficulty with and challenges with compliance, right? So we're rolling out education programs and recognition program. We have a new one called the 5 points program, where essentially you and your partner in the ambulance do a call out. The person up front, before they put the vehicle in drive, yells to the person in back, 5 points. The person in back confirms, 5 points. We know that patient is properly secured with the shoulder straps in place. That seems maybe silly, but it's a small way that we start a culture to improve patient safety at the agency level with an individual patient that makes it doable for me, the individual paramedic, but doable for us on a larger scale as a system, even up to a policy component working with our partners over in highway safety. A big thing that I wanted to make sure that I stress is, can you look and say where your safest EMS programs are? That's a big challenge for me in Maine. I don't think I have great data, and I'm not even sure I'm asking the question the right way, but I would encourage anybody who's an EMS leader to ask that question of your own agency. Who's your safest driver? Is it your trainer or is it someone else? And in your state, who is your safest by criteria that we could draw out as KPI? Who's your safest EMS agency, and what learning points do they have to offer? Do they have a rigorous driver training program in place? Do they train annually, quarterly? Do they have cameras and speed detection equipment in place? Do they have established FTO programs that people have to be in for 2 or 3 years before they're rolled out? Or is it much like our agency occasionally does, we put the light green with the dark green and get them out the door, right? Which, as we know, can contribute to risk. So, those things I've talked about, speed detection, safe roadway monitoring, dash cameras, et cetera. But one other thing I wanted to mention was reducing code 3 response. This is a big one to me, and Director Stewart, we've talked about this a lot, but I think industry-wide, this has been a challenge for a number of years. We can look at time-sensitive illness around cardiac arrest, anything that puts a whole or blunt trauma on you. But really what we want to see is a reduction overall in the number of vehicles traveling in emergency mode on the roadway when the data does not support it. And that would be outcomes data, right? Did you arrive at a hospital, get admitted, and then need to be discharged after some period of time, or did you not survive? And was it worth it to increase the risk? We were able to look at this in Albuquerque, New Mexico. I would encourage other systems to just look and say, hey, just as a general start, using the data that we have available, are there code 3 responses we might be able to reduce risk by doing less of, because the data does not support that we're seeing patients ever leave those scenes emergently. Eye injuries were a category that we found very quickly in looking into that. But I do want to move on to make sure that we stay on time. And, again, I was talking a little bit before about what the evidence was telling us. If for us, wake effects remain understudied. Wherever you go, that's the thing. It bothers me. I'd like to know a lot more about how many accidents we create rather than the things we're doing to help people. Whole blood administration by EMS has the potential to improve pre-hospital trauma outcomes. But a unique challenge in many states, and one we have here in Maine, is we have a lot of one-lane rural highways that are way out there. Your time to being identified as someone who had a crash could be significant. Your time to have someone respond to that crash could be significant. So while some areas in Maine may start with that 43%, some areas in Maine may start more like a 12%. And we really want to look at, as we roll those programs out on a larger scale, how do we leverage that partnership with highway safety and the data that's available through NHTSA, right, 911.gov, EMS.gov, rather, and our partner, Director Stewart, to really make sure we're making common sense decisions around financing, funding, and legislating those things. Lastly, as things move forward, things have moved forward faster than us, right? As an ambulance agency, I had policies for safety around ambulances, but now I've got community paramedics out there, some of them in their POVs. I've got fly car models with nurses and CCT trucks joining up, and I've got physician response in the field. So those are other areas of potential risk and danger that we're talking about in this continuum of safety that we really want to address with our highway safety partners, right? And internally, right, with NASEMSO and with EMS.gov to say, okay, based on all the data we have together, EMS fellows working in the field, what do they bring? You know, we're seeing that they do a lot of BLS skills, a lot of ALS skills, and very rarely a physician skill. We know if they're running code 3, they increase risk. How do we put all those things together to draw up a program that supports a protocol from a pilot project so we know what safe physician response should look like in any state? So I know I talked a lot because these topics are of great interest to me, but I just wanted to wrap up and let folks know that the last piece of what I see here and where I really think we have the potential for our agencies to connect not just with highway safety, but downstream with our hospital partners is on the outcomes data piece. That is so crucial for us to be able to move to the next part of the discussion on how do we finance, fund things, is that piece of data is how are we impacting with the efforts that we're putting into place and what populations are we trying to serve. So thank you for the time today, really appreciate it. And I'm going to pass it back to y'all for any questions.
Thank you, Director O'Neal. Okay, now we'll move over to the Q&A portion of today's webinar. Please submit questions using the Zoom Q&A feature at any point. And any unresponsive or responses to any unanswered questions, we're going to be putting those online with the archive version of this recording on EMS.gov. So question number one, Director Stewart or O'Neal, can I get either one of you to talk about your Section 405 funds and how they were applied to post-crash care or EMS?
Sure. Yeah, thank you for the question. I'd be happy to start talking about that, and then maybe Director O'Neal can fill in some information. But as you can imagine, we used the House Alert system because it was easy for us to jump onto a master agreement that another state was already using. So we went that route. It's very, very expensive. Director O'Neal indicated $1 million, but it was like $1.4 million. And there's no amount of the 405H funding that's going to cover a project quite that large. But Maine was one of the 3 states who qualified for Section 405E comprehensive distracted driving money. And so every year that we were eligible for the comprehensive distracted driving money, we got a little over $2.4 million in 405E money. And because our MUC compliance was always at least 75% compliant with the latest edition of MUC, we were able to flex 75% of that 405E comprehensive distracted driving to other 402 eligible uses. So for those of you that are unfamiliar with the funding sources, 402 is a very flexible funding source that state highway safety offices get to do all of their projects. And then the 405 are incentive grants. So not all states qualify for all of the incentive grants. But we got a lot of money in the 405E back in the day, and we have a finite number of years to spend that money. So I was sitting on a large pot of older 405E money that I needed to use. And the then EMS director, Sam Hurley, said, hey, I'd really like to do this project. What do you think about it? And I said, well, I think it's expensive, but I do have this pot of money. I think we can fund it. But most importantly, we were experiencing those secondary crashes that Director O'Neal talked about, where the public was running into ambulances on the side of the road when the folks are trying to render post-crash care. And I thought this is a great way for us to save the lives of not only our first responders by letting the public know that they're there or they're en route or they're around the next corner, but also to make sure that our public, we're saving the lives of the public by letting them know that an ambulance is coming. So twofold: saving those first responders and saving the lives of our general public through this communication mechanism or alerting system that provided you have some sort of a navigation system in your vehicle, you're going to get warning that an ambulance is rendering post-crash care up ahead. And so I just saw real benefit in it. It was rather new, innovative, as I said, very expensive, but I'm glad that we tackled the project and that we had the ability to do so. So hopefully that answers your question.
Director O'Neal, anything to add?
Nope. I think based on the answer you just heard, you folks would understand why I always try and back clean up for Director Stewart, because she is very skilled and knowledgeable. It is my ambition to, at some level, to be able to understand the different funding streams and grants in the way that she does. But staying closely partnered with her has helped ensure our success in these areas. I promise you that.
Good answer. All right, I have another question. Has Maine hosted any federal highway free traffic incident management trainings for law enforcement, 911, EMS, and other first responders?
Yeah, if you want, I can jump on that one also. The answer to that is yes. We have numerous traffic incident management committees all around the state. We have a statewide committee. We have one up in that Aroostook County that you saw, where only the moose live. We have some in Penobscot County. We have them in the Mid-Coast region. So yeah, we have committees all around the state, and they're made up of stakeholders, which are law enforcement, fire, rescue, towing, recovery, transportation, local transportation agencies, and they are continuously doing TIMS trainings and train the trainer trainings. And I think we have a really good system in place here in Maine for that.
Okay. Another question, going back to the HOS notifications, are there other first responders using HOS in Maine?
I am not currently aware of anyone else that's connected in a project in the way that we are, but I can't say that with 100% certainty.
I could add to that, obviously we weren't able to outfit all of the ambulances and first responder vehicles. We started with our most rural agencies because obviously they are, we talked about how hard it is to get from point A to point B sometimes here in Maine. So our project started with the most rural of the rural. But I do know in conversations with agencies who were unable to take part in that program, that a lot of them would try to jump on that master agreement and outfit themselves with their own funding as much as possible. I don't know if that has happened. They're not required to let us know if they have done so. But I think if they are able to, it would certainly benefit the state as a whole.
Okay, thank you for that. Another question, is there training for EMTs, highway safety officers, and local police on how to input crash data and understand mode bias? And how can we leverage the next piece of the puzzle when addressing responses to crashes and prioritizing fixing high crash modes or segments? Nodes, excuse me, high crash node or segments.
I'll give this one a shot. I'm going to say right up front, I don't know what mode bias is, but I can answer the question as far as crash report training, and the answer is yes. Every one of our law enforcement officers receives in their basic training a good portion of time on how to enter into our main crash reporting system. We are 100% electronic with our crash report. We only have one crash report for the entire state. I know some states have multiple versions of crash reports, but we have one. We're 100% electronic, and every police officer is trained on how to enter those crashes. Regarding the DOT, we're also heavily involved with and partnering with our DOT. As a matter of fact, we take our raw crash database and we transfer it, file transfer it over to our DOT, who then does their cleansing of that, and they make sure that the locations are correct, that then, the nodes and segments and all those things, so that we can really pinpoint exactly where the crashes are happening. So again, I'm sorry that I don't know what your mode bias is, but I think together with our DOT and our law enforcement, we have excellent crash reporting.
Okay. Another question. Do you know of any studies that look at the moth effect regarding the impact of emergency lights? Do you know of any studies that look at the moth effect regarding, oh, they just wrote the question twice. Sorry. So to repeat, do you know of any studies that look at the moth effect regarding the impact of emergency lights?
I can speak to that briefly. Just in the very distant past, we've had some conversations about, the utility of and whether or not these were potentially creating a distraction or adding to the danger. Where that landed was it stayed in discussion. For most places, they're just very firm that they're going to keep the two lights and sirens together and that they're going to be grouped in a way that makes sense in emergency response. There's a lot of, especially here in Maine, right? We find folks that want to kind of look at, should we be changing this or changing that? And there is quite a bit of variability. The hardest thing for a regulatory agency, right, is to continue to provide clear guidance around things. And so for us, looking at some of the studies and making sure we're making database decisions, I think is important. But also when we start talking about the impact of emergency lights and driving code 3, et cetera, we really want to focus on where the clear data towards safety lies. And I haven't engaged, as I was transparent about, in those studies anytime recently. It looks like Megan may have a better answer.
Okay. Is the state data shared with municipal emergency response departments? If so, does the county government play a role?
Are we talking about EMS data, or are we talking about crash data? If we're talking about crash data, that is shared with municipal agencies through the availability of a crash query tool. So the state of Maine, one of the things we did with our traffic records coordinating committee and our Maine DOT was we stood up a public query tool where the public can go in and query crashes for a single year, multiple years. They can drill down into locations. They can see whether, speeding played a factor or distracted driving. So we have data that is available, crash data and citation data that is available for any municipal emergency response agency, any municipal, county, or state law enforcement agency. So hopefully that answered your question. If not, I'm happy to discuss it further.
And I would jump in and say, well, related, but not really an answer. Our EMS agencies, under the stream of data that we have, end up kind of at the end point owning their own data. So they are able to mine that on their at the agency level to look at what types of calls they're responding to, and then dovetail that into that larger crash data, what types of crashes are happening in their area, et cetera. So I think it's a helpful partnership in data share.
Thank you. Can either of you talk about how an EMS office should first engage with a state highway safety office to create or improve a triennial highway safety post-crash care section and consider data for that entry?
This is a great question. I think it was so easy. I took it for granted that if you're in an EMS office where it's harder to put this together, that's why I wanted to kind of offer that guidance that EMS offices are kind of hard to find, but highway safety is pretty straightforward, right? And I would just encourage you to reach out with an email. What you'll find, I think, is very traditionally, and this has been my experience with the folks that I meet around Director Stewart, is they're very engaged in highway safety and they have a lot of energy and time that they want to put into these projects to improve, because unless your state is killing it right now, and I was probably a poor choice of words, your state is probably more likely to be killing it right now because we're seeing a huge increase in distracted driving, pediatric and pedestrian accidents, people, speeding on our larger rural highways. So, I do think that it's very important for us to continue to build that relationship and have those conversations.
I 100% agree with that. And I will also say that if you're familiar with the safe system approach, you know that as a highway safety office, you have to do your due diligence and go and find those EMS people, because if you're not, then you're not instituting a safe system approach. So Director O'Neal is correct. Most highway safety offices are either located in their departments of public safety or their departments of transportation. There's a few scattered in your motor vehicles or some standalone offices, and a few are actually underneath their state police. But for the most part, you're going to find us in public safety or the Department of Transportation. And it's up to us to go find those EMS folks and make sure we're, as I discussed in my presentation, make sure you're getting the data that you need from them and make sure you're giving them the data that they need as well. And that's, I think, where the partnership and the relationship really comes to fruition and how those projects are built. Traffic records is another place where there's just an opportunity to share a lot of data between EMS, crash, citation, warnings, you name it. So we're always looking for ways to fold more data into our warehouses, and EMS is a treasure trove of data. So thank you for that question.
Okay. Is the actual implementation of the TIMS practices, traffic incident management practices by emergency responders, tracked or measured in Maine?
Yes, we track the number of trainings that we do and the number of whether it's law enforcement or first responders or fire who are trained. But near miss data is not something that we, to my knowledge, have access to here in the state. Director O'Neal may know different.
That is correct statement, Director Stewart.
Thank you. Another is asking, has Maine EMS considered requiring TIM 4-hour responder training for EMS relicensing or licensing?
Yeah, as the regulatory agency, we do a lot of conversation behind the scene, especially between sessions, about how do we want to prioritize what we're going to get done as the next thing. And does it require a rule change or a statutory change, or is it something we're allowed to just do? Also, at some point, we have to gauge what will be the cultural acceptance and what is the prioritization of its impact, right? And so while we believe that training is very important, we also have kind of, I think, some significantly larger fish to fry in terms of overall safety and what we can communicate to our providers. And we have the additional challenge that every time we want to tell them what to do, it takes a much different path than when we're able to have them ask us to ask them what to do. And so that's a thing that we actually manage better at the EMS board level through our structure, but it is something that we are considering asking about making a requirement because we want to continue to enhance safety, and standardization and regular training we know is a way to do that.
Okay. I think we've got time to entertain 2 more questions. So could you describe how both your agencies interact with public health assets throughout your state?
I could start with that one, Director Stewart, and then you probably have your own set of answers as well. For us, we have a statutorily put in place trauma advisory committee. It's the State Trauma Prevention and Trauma Advisory Committee, but that is our public health asset that also connects us with the CDC, right? And so when we are collecting trauma data on injuries, we're able to work with our TAC, which is also connected with our trauma hospitals. We only have a level 1 and our level 2 hospital currently. We only had 3 and now we're down to 2, but the entire system of 38 hospitals is considered our trauma system, right? And so that TAC is the way that we're connecting with those public health assets through the CDC, and then back to Lauren's group, right, is really looking and saying, okay, for our partners at the CDC, in the public health realm for high consequence infectious disease, we're working here. For safety for providers, we're working here. And then what data do we share back and forth through the TAC to say whole blood's going to make sense because this percentage of trauma occurs in this way in Maine and arrives to the hospital alive in this time frame. So here's where we would focus that whole broad project for whole blood. That's an example, I think, of how we kind of interact with those public health assets, at least on the EMS side.
Yeah, and I don't really have more to add to that. We also work with our health folks in their data because we know that motor vehicle crashes are a leading cause of death. So, public safety is public health. So we utilize whatever data and studies that they have to help us with our programming as well.
Okay. And the last question. What is Maine's main performance measures or measure for EMS related as it relates to crashes, and how do you monitor it?
Could I get some clarification on the question? Are we talking about ambulance involved crashes? Or are we just talking about roadway crashes in general?
If you can answer both, that'd be great.
So, as I articulated in the beginning, we actually are more challenged to collect data on ambulance accidents than we are on almost any other kind of accident. There's a bunch of different reasons why that still exists, but that's the thing that I've got the sledgehammer working hard on pretty much all the time. When it comes to crashes and looking at KPI for crashes, it's really looking closely at what kind of trauma that we're seeing, that we're taking to hospitals and what outcomes look like, and then meeting with Lauren and Lauren's team and saying, what's happening, right? Because when we see an increase in death on the roadway, Lauren's got the data that from the officers reporting that shows us like, here's the most likely things that are occurring, right? And then that can fold back into an education program, or even for those folks at the very local level, an ambulance wrap program, right? Something that just advertises to your community, speed kills, right? It takes 5 seconds. You work with your highway safety department, you fund a wrap, you get it on your ambulances, and maybe one person gets saved from reading that. Makes a difference, but in terms of monitoring the key performance measures, it's really those measures are in place, but our ability to budge them because of the number of different variables affecting them is very challenging, I would say.
Yep. The only other thing that I could add to that is for our alerting technology project, we had a performance measure regarding crashes involving first responders. And of course, our objective was to decrease, using this project to decrease any crashes involving first responders. So that's how we measure it.
And that was done, I'm sorry, Lauren, I just wanted to clarify. That was done with additional resources through our partners at Southern Maine and their data team that we don't normally have in-house.
That's correct. Yes.
Okay, thank you.
Okay. I think we'll bring our Q&A session to a close now. So, Director Stewart and Director O'Neal, thank you both so much for sharing your time and your insight with us today. Much appreciated. Okay, that's going to conclude today's EMS Focus webinar. An archived version of today's session will be available soon on www.ems.gov. Thank you for joining us, and we hope to see you at a future EMS Focus webinar.
Thank you all very much.
Thank you very much.